Hi there, I'm Dr. Michael Bennett. For over 30 years, I've worked with men across the country to help them navigate the changes that come with aging, especially when it comes to sexual health. And today, I want to talk to you about something most people shy away from but shouldn't: masturbation after age 60. Now you might be thinking, what's the big deal? I've been doing this all my life. It's harmless, right? Well, I used to believe that too, until I started seeing more and more older men in my practice facing issues they never connected to this deeply personal habit. Here's the truth: masturbation isn't dangerous in itself. In fact, it can be a healthy part of your sexual life. But after age 60, our bodies begin to respond differently. Hormone levels drop, tissues lose elasticity, blood vessels become more fragile, and the prostate, that small gland so central to male pleasure and function, becomes more sensitive and vulnerable. What worked for you in your 30s or 40s might actually cause harm now. I've seen men with chronic pelvic pain, difficulty urinating, erectile dysfunction, and all of it linked back to unconscious habits around masturbation. Not from doing it, but from doing it without adapting. Let me tell you about Jim, a 68-year-old retired teacher who came to see me last year. He was tired all the time, waking up to pee multiple times a night, and said intimacy with his wife just didn't feel the same anymore. He thought it was just aging. But when we talked more, it turned out he'd been masturbating the same way he had for decades. Quickly, tightly, often in secret, and using intense porn for stimulation. We changed a few simple things, slowed things down, reduced the frequency, added awareness and self-care. Within a few weeks, his energy started to return. His sleep improved. And most importantly, he began reconnecting emotionally with himself and his partner. That's why I created this guide, to help men like you make a few key changes that could protect your prostate, preserve your vitality, and maybe even reignite a part of yourself you thought was fading. In this video, I'll walk you through 6 common mistakes men over 60 often make when it comes to solo intimacy, and I'll show you practical, research-backed ways to shift those habits. This isn't about shame, it's about wisdom. You've earned the right to feel good in your body, in your relationships, and in your own skin, no matter your age. So if you've ever wondered, is this still good for me? You're in the right place. Let's talk about it. Let's dive into the first, and perhaps most common mistake I see men over 60 making when it comes to solo intimacy: forcing an erection or rushing to ejaculation. Now I get it. We were raised in a generation that often tied our masculinity to performance. Get it up, get it done was the unspoken rule. But that kind of thinking can become harmful, especially as your body changes. After 60, your erectile tissue becomes more delicate. Blood flow slows down. Nerve endings are less responsive. And testosterone, the hormone that used to drive desire and recovery, is now in shorter supply. So what happens when you grip too tightly, move too fast, or push your body to climax like you did at 25? You create micro tears in the soft tissue. You increase inflammation in the prostate. You desensitize the very parts you're trying to enjoy. Let me share a quick story. Peter, a 71-year-old widower, came to see me with burning pain during urination and a strange numbness during sex. He was scared it might be cancer. Thankfully, it wasn't, but the cause surprised him. Turned out, Peter had been forcing erections by tensing his pelvic muscles, watching high-intensity porn, and rushing through the act because he felt embarrassed about it. Over time, that get-it-over-with attitude led to damaged nerves, chronic irritation, and complete emotional disconnect from his own body. So what can you do instead? Start by letting go of the idea that orgasm is the goal. Touch doesn't have to lead to climax. It can just be about reconnecting with sensation. Use slower movements. Focus on breathing. Pay attention to what actually feels good, not just what gets you hard. If you feel tension or discomfort, stop and ask yourself, what is my body trying to tell me? And here's something I always tell my patients. Intimacy is not a race. It's not about how fast, how hard, or how often. It's about how present you are. Try this tonight. Light a candle, put on soft music, and instead of finishing, try simply enjoying the feeling of touch. Let your mind rest. Let your body lead. You might be surprised at how healing it can be, not just physically, but emotionally too. Finally, remember this: your body has changed, and that's not a weakness. It's an invitation to relate to yourself with more care, more patience, and more respect. Let's talk about something that many men feel embarrassed to admit, even to themselves: a growing dependence on pornography. If you're over 60 and you found yourself turning to porn more often, even when you're not really aroused or when it leaves you feeling emptier rather than satisfied, you're not alone. I hear it all the time in my practice, and no, this isn't about judgment. It's about awareness. You see, as we age, our brains become more sensitive, not less. Contrary to what many think, the older brain doesn't become immune to stimulation. In fact, it can become more reactive, especially when the stimulation is artificial and intense, like most modern pornography. Back in the day, you may have flipped through a magazine or imagined someone you loved. But today's content? It's designed by algorithms, fast, extreme, and emotionally detached. It's not about connection. It's about novelty, shock, and dopamine. And here's the issue. The aging brain craves stability and emotional resonance. When we feed it high stimulation content, over and over again, it starts to dull its response to real-life intimacy. You may notice it subtly. Maybe you don't feel as drawn to your partner anymore. Maybe your arousal only works when watching something online. Maybe you feel more alone afterward, not less. Let me tell you about Alan, 66, recently retired and married for over 40 years. He came in confused and ashamed. He told me, "I love my wife, Doc, but when we're together, I feel numb. But when I watch porn, it's like I come alive, but then I crash." Alan had unknowingly trained his brain to respond only to screens, not skin, only to fantasy, not feeling. We worked together to slowly reduce his porn use, not with guilt or shame, but with replacement. He started using memory, warm, real, emotional memories to guide his arousal. He practiced touching himself without the goal of climax, simply to explore sensation, and slowly, that emotional spark, the connection to his wife, started to return. So here's my invitation to you. If you feel caught in the loop of digital stimulation, ask yourself, what am I really looking for? Because most of the time, it's not sex. It's comfort, it's connection, it's meaning. Start small. Take a break for a few days. Notice what feelings arise: loneliness, boredom, tension, and sit with them. They're not your enemies. They're signals. In the next section, we'll talk about frequency. How often is too often, and why recovery is different for men over 60. But for now, just remember, your brain is wired for intimacy, not overload. Reclaim your sensitivity. Reclaim your connection. In this section, let's talk about frequency, how often you masturbate, and why that matters more than ever after the age of 60. Now, let me be clear. Masturbation in itself is not the problem. It can be healthy, pleasurable, and even healing. But when it becomes too frequent, especially without proper recovery time, it starts to take a toll, not just on your body, but on your mind and energy. After 60, your system changes. Your testosterone levels drop, your nervous system slows down, and your recovery period, the time your body needs to restore itself after ejaculation, gets much longer. But here's what I see often. Men using masturbation as a way to fill time, avoid loneliness, or relieve stress, sometimes 2, 3, even 4 times a day. At first, it feels like release. But over time, they feel drained, foggy, even irritable or anxious. Their sleep suffers, their libido drops, and they begin to feel emotionally numb. Let me introduce you to Marcus, 64, single, recently divorced. He told me he'd been masturbating up to twice a day, every day, for months. Why? "It helps me sleep," he said. But ironically, he was waking up more tired, feeling sluggish with no motivation. He thought it was depression, but it wasn't. His nervous system was simply overstimulated and under-recovered. Here's the science. Every ejaculation requires a surge of energy. It activates the sympathetic nervous system, the fight or flight mode. But after climax, the body must shift into parasympathetic mode, the rest and repair state. The older you get, the harder it is to make that shift, and the more rest your body needs to fully recover. So what's a healthy frequency? For most men over 60, I recommend starting with no more than 1 to 2 times per week. And remember, You can explore pleasure without always ejaculating. You can touch, breathe, connect, and stop before the peak. This approach not only protects your prostate and hormones, it also rebuilds your desire. It gives your body space to crave instead of just release. Try this. Go 1 week without ejaculating. Instead, focus on sensation, not stimulation. Notice what arises. You may feel more energetic, more clear-headed, even more emotionally tuned in. But for now, take a breath and ask yourself, am I giving my body the recovery it truly needs? If that question stirred something in you, don't ignore it. This is your invitation to start treating your body like an ally, not a machine. Hit subscribe if you haven't already, and join me as we continue this presentation, where we'll explore how small changes in your posture and habits can protect your prostate and improve nighttime comfort. You deserve to feel whole again. Let's take that step together. Let's talk about a part of your body that most men ignore until it starts screaming for attention: your prostate. This small gland, about the size of a walnut, plays a huge role in your sexual and urinary health, and after 60, it becomes more vulnerable than ever. Here's the mistake I see all the time. Men continue to masturbate or have sex in ways that put pressure on the prostate, and then they forget a simple but crucial step: urinating afterward. Why does that matter? Because during ejaculation, fluid moves not only through the penis but also through the prostate. If you don't urinate after, residual fluid can stay in the urethra and prostate ducts, leading to low-grade inflammation. Over time, this causes symptoms like frequent nighttime urination, pelvic heaviness or discomfort, and that frustrating feeling of never fully emptying your bladder. Many men assume, well, I guess it's just part of aging, but in many cases it's not. It's a preventable pattern. I had a patient, Larry, 67 years old, who came in complaining of needing to pee 4 or 5 times a night. His sleep was wrecked, and he felt exhausted every morning. He had no idea that sitting hunched over his laptop to masturbate, then falling asleep without urinating, was silently irritating his prostate. Once we adjusted a few things, posture, timing, and bathroom habits, his symptoms improved within weeks. Here's what I recommend. Always urinate after ejaculation, whether through sex or masturbation. This helps flush out leftover fluid and bacteria. Avoid staying seated in a hunched position right afterward, especially for long periods. This traps pressure in the pelvic area. Consider gently massaging the perineum, the soft area between the scrotum and anus, to help circulation and drainage. And most importantly, listen to your body. If you feel pelvic heaviness, pressure, or burning, don't ignore it. That's your body speaking. And the prostate is one of the few organs that talks through discomfort, not pain. Caring for your prostate isn't about being weak, it's about being wise. You've made it this far in life. You deserve peaceful nights and powerful days. As we continue this presentation, we'll talk about something that seems small but makes a huge difference: lubrication, and why it's not a sign of weakness but a tool for longevity and pleasure. And if this section helped you rethink even one small habit, hit subscribe, leave a comment, and let me know how it's going. You're not just aging, you're evolving. Let's keep doing it with care. Let's talk about something simple but powerful: lubrication. Now I know some men hesitate at the very mention of it. They think it feels weird, or isn't that for women? Or needing lube means I'm getting old or weak. I've heard it all. And every time I hear that kind of thinking, I see a missed opportunity. Because not using lubrication after age 60 is like driving an old car without oil. It wears you down faster and leaves lasting damage. As you age, natural moisture production decreases, not just for women, but for men too. The skin becomes thinner, the tissues more fragile, and the body's ability to self-lubricate, especially during solo player intimacy, drops significantly. This means that even gentle touch can lead to microabrasions, irritation, and long-term sensitivity loss. Some men even develop low-grade inflammation without knowing why, and it all comes down to friction. I had a patient named Jorge, 72, widowed and exploring intimacy again for the first time in years. He came in with persistent burning sensations and a fear that something was wrong. After a full checkup, we ruled out infections and serious conditions. The cause? Dry friction. He had been avoiding lube out of embarrassment. Once he started using a gentle, water-based lubricant, his symptoms disappeared, and he said it completely changed the way he experiences touch. Lubrication is not a sign of weakness. It's a sign of wisdom. It enhances pleasure, prevents injury, and restores your body's capacity to enjoy connection without pain or shame. I recommend choosing a water-based, fragrance-free lubricant that's gentle on sensitive skin. Avoid products with alcohol or warming agents, as these can cause burning or inflammation. Keep it visible and accessible on your bedside table, not hidden in a drawer. Normalize it. Apply it slowly and consciously as part of the sensory experience. When you use lubrication, you're saying to your body, I care about you. I want this to feel good. I'm not rushing you or ignoring your needs. That kind of message can be deeply healing. As we continue this presentation, we'll talk about the final and most subtle mistake, disconnecting emotionally during solo intimacy, and how to turn masturbation from a routine into a moment of emotional reconnection. If you've never tried using lubrication, or if you've avoided it for years, this is your moment to give it a chance. Subscribe and share if this resonates with you. Tell me, what has your body been asking for that you haven't given it? You're not just surviving aging, you're learning how to thrive in it. Let's keep going together. This final mistake is the quietest, but perhaps the most damaging. Losing emotional connection during masturbation. For many men over 60, masturbation has become routine. Something mechanical, almost like brushing your teeth. You do it out of habit, out of boredom, out of stress, but not out of joy or intimacy. And that's a problem, because over time, this kind of mechanical touch numbs you, not just physically, but emotionally. Let me ask you something honestly. When was the last time you actually felt connected to yourself during self-pleasure? Not just aroused, but present, tender, even grateful. Most men I work with say, it's been years, maybe decades. And that disconnect matters, because your emotional system doesn't shut off during sex. It's always there, always listening. I had a patient named Daryl, 69, divorced, living alone. He told me he'd stopped dating because intimacy didn't feel real anymore. And when I asked him about his solo habits, he said, honestly, Doc, I just get it over with. I don't even feel anything anymore. I just do it so I can fall asleep. What Daryl didn't realize was that he wasn't just disconnecting from others. He was disconnecting from himself. His body had become a task, his pleasure, a checkbox. And when you treat your body like a machine, it starts to shut down like one. So what's the antidote? Slow down. Create space. Turn a routine into a ritual. Set the scene. Dim the lights. Play soft music. Breathe deeply. Make the moment feel safe and sacred. Place a hand on your chest or belly while touching yourself. This activates emotional awareness and grounds your nervous system. Let go of performance. Don't aim for orgasm. Instead, focus on sensation and what feelings arise. If emotions come up, such as sadness, tenderness, or even tears, welcome them. They're not a mistake. They're a release. This kind of presence doesn't just heal your relationship with your body. It brings back aliveness, the kind you thought was lost forever. And it's never too late to reclaim that. As we conclude this discussion, we'll bring everything together and talk about how solo intimacy after 60 can become a path of healing, connection, and self-respect. For now, I invite you to try this one simple shift. Next time, don't just get it over with. Make it a moment of listening, of feeling, of coming home to yourself. If this message resonates with you, subscribe, leave a comment, or simply close your eyes and breathe it in. You are not broken. You are becoming whole. If you've stayed with me through this discussion, I want to thank you. Because the truth is, this wasn't just a talk about masturbation. This was about reclaiming your relationship with your body, with aging, with pleasure, and with presence. We've explored 6 common mistakes men over 60 often make when it comes to solo intimacy. Forcing erections and ejaculation, becoming dependent on pornography, doing it too often without recovery, neglecting prostate care, avoiding lubrication, and disconnecting emotionally from the experience. But underneath all of these, there's one deeper shift we're being invited into, a shift from performance to connection. At this stage in life, sexuality is no longer about proving anything. It's no longer about speed, strength, or reaching a goal. It's about being present with yourself. It's about listening, not pushing, feeling, not fixing. Masturbation after 60, when approached with care, can become something entirely new. It can be a practice of healing old wounds, of rediscovering pleasure without pressure, of honoring the body that has carried you through decades of life. I've seen men break down in tears, not because they're sad, but because they finally felt something real again. Touch that wasn't just friction, but presence. Pleasure that wasn't escape, but connection. Maybe you've lived most of your life being told what a real man should be. Maybe you've spent years ignoring your body, rushing through sensation, or feeling ashamed of your needs. But here's what I want you to hear and hold. You are not broken. You are not too old. You are not done. You're entering a different season, one where depth matters more than intensity, where less is more, where slowness is sacred. So what now? Start with one small change. Maybe it's using lube for the first time. Maybe it's turning off the porn. Maybe it's placing your hand on your heart the next time you touch yourself and just breathing. These aren't fixes, they're invitations. To shift from habit to ritual, from numbness to presence, from shame to care. If this message moved you, please subscribe, share this with a friend, or leave a comment. Tell me what this journey has opened up for you, and most of all, keep going. Keep honoring your body, keep listening, keep showing up. Because this stage of life isn't the end of your story. It's the beginning of a more honest, more connected, more loving chapter. Let's walk it together.